Gina, my dog has epilepsy. I got her off phenobarbital and onto CBD oil, but she still takes potassium bromide and seizures seem worse since vet prescribed urinary diet after she found struvite crystals. Any natural diet recommendations to help seizures?
Well,
So
um,
here's the disclaimer. So
mm,
each pet will be different. We are looking at just so we're not offering medical advice because we don't know the full record. So everything that we say, take it with a grain of salt and make sure you ask your veterinarian before you do any adjustments because it's based on our opinion. We don't have a veterinary client patient relationship. So keep that in mind when we are discussing some of these cases. So I just wanted to throw that disclaimer out there.
yeah. So basically, a urinary prescription diet is probably going to be higher in carbohydrates. So carbohydrates are pro-inflammatory, and they could potentially make seizures worse because it creates more inflammation in the brain. And to start with, it creates more inflammation in the gut, but then also as a result, more inflammation in the brain. So probably working around with that. And I don't. Did you mention what kind of crystals?
I think she said struvite.
Oh, okay.
So it's a dog. I don't know if
Yeah,
they
I
did a
mean,
urine culture to rule out a bacterial infection.
yeah. And with different kinds of crystals, different diets work better, and you have to kind of balance out the pH and that sort of thing. And that can definitely be done with diet. And I haven't seen any crystals in a while, but I think struvites, they do better with lower pH, if I remember correctly, right? So then a raw food diet would, like one that's higher in protein would create a lower pH, so would acidify the urine, which would help with crystals. And yeah, with crystals, you always have to find out, did they actually look at the urine right away? Because sometimes letting it sit can cause, crystals to form, even though there are really no crystals there. Looking at urinary tract infections and things like that. Um, but with seizures, obviously we have to be careful because the brain doesn't really like to have seizures. So we have to keep them under control as much as possible. From the neurologists that I've talked to, they prefer having one seizure every like blue moon rather than having smaller seizures more frequently. That apparently seems to be worse for the brain. So definitely um, maybe going with more with a ketogenic sort of diet if your animal can handle it would be one thing to do. And again, any transition, anything you would want to do more slowly. And um, given the fact that this dog had some phenobarbital removed, I'm wondering if that could also be part of what causes the increase in seizures and decrease in control of seizures, especially as they get older. The brain doesn't work as well. So I'm wondering if that's maybe part of it, because what I often find is that people say I did this and then that happened, but we don't really know because there are always a lot of factors that play a role, and just because you know we did something doesn't mean that that was really the result of that. There could have been something else. So for example, when somebody tells me, oh, my dog just got an acupuncture from you and it's limping so much less, and I'm like, well, maybe it was just the time that it took since the last visit that I saw you that allowed some healing, and maybe it was the acupuncture, but maybe it wasn't. So I'm not very big at saying that's exactly what did something or didn't do something, because then I don't, it kind of puts a little bit of blinders on me, and I like to not have those too much. So um, it's always worth exploring other possibilities as well.
The biggest thing is the diet. And there's a lot of study. Keto Pet Sanctuary is a great resource to check out. They're the ones that have put out a lot of case studies and reports about the ketogenic diets. So using things like MCT oil to help. Now, this is where work with your veterinarian or work with someone, or else we can cause like diarrhea if your pet's not ready for that. So that's where you definitely need to slowly transition to something like that and potentially work with someone that is familiar with how to do that. But getting that carbohydrate content down. And why are we seeing struvite crystals? Is it because the urine is sitting there? Typically in dogs, struvite crystals they're more common in cats. And if we're seeing struvite crystals, is there a urinary tract infection? Is there a stone? Is there, we're seeing a lot of bladder cancer. Is there some type of inflammation or nidus that's causing those crystals to form? But definitely 100% getting to a fresh food or a raw food diet will help bring down that urine pH if it's too high, and get it back into that normal, like, typically like 6.5 range that we want them at for a urine pH. Lots of water too. So the other downside with kibble, super dehydrating. It doesn't have a lot of moisture content in it. And that's where fresh food, raw food diets are a lot more moisture. But I usually ask for my patient or my clients to add water into those diets too, to help kind of flush out that inflammation. But by transitioning away from a kibble diet or a processed food diet, that can help. There's a lot of studies regarding the carbohydrate content, and especially in people with epilepsy, getting them off of high carb diets onto higher fat diets and higher protein are one of the biggest things that can help seizures. I'm going to go into a controversial area because it was a huge part in helping my dog have less seizures. He had a brain tumor, so he's a little bit different than just like a dog with idiopathic epilepsy, but we use CBD with him. So that's something where you need to ask your veterinarian, because with seizure medications, it can affect the half-life of how the CBD is processed through the different pathways in the liver. So definitely ask your veterinarian or find someone who's familiar with how to use CBD, because they may not be comfortable discussing CBD, or they may not know enough conventional veterinarians. So it doesn't mean that you can't. It just means you might have to find someone to help guide you in that discussion. But CBD in Chinese herbal medicine was the biggest change that we had for Finn, that gave us another year of life when he did really awful on seizure medications and conventional medications. So diet, CBD, Chinese herbs, and just really helping his detox pathways and things like that, and keeping things feeling good. And no one knew he had a brain tumor because the dog was a crazy, mad old shepherd, like running around, and he felt great. And so those things, I would definitely, look for someone, go to the AHVMA, find someone that is certified in Chinese herbal medicine, because there's different imbalances that cause the seizures, and we can use herbs to help calm down those imbalances, depending on that individual pet and their constitution. So those would be kind of some of the things I think about, especially going through what I went through with Finn.
Yeah, and there are some veterinarians that will also implant gold beads in different acupuncture points to also reduce seizure frequency, especially with those that are very hard to control. So there are definitely a lot of other things that can be done.